Hello friends, this is Dr. Shahid from Drug Villa Clinic Saket. Today we will be talking about understanding a heart attack. In today's session, we'll discuss about the heart attack, its causes and preventive measures needed to avoid heart attack. Nowadays we often come to know a person has a heart attack even at the age of 30 or 40. Incidence of heart attacks and number of deaths due to are consistently increasing in the last few decades. So let's understand what is heart attack and what can be done to prevent it. Heart is the most essential organ of the body. It's crucial for the survival. Its functions like the pump allows the circulation of the blood throughout the body. Blood circulated through the extensive network of various types of small and large vessels. Blood ultimately provides the nutrition to the organs supplied to various organs which are necessary for normal functioning of the particular organ. The muscles of the heart continuously contract and relax to pump the blood into the vessels. This pumping of heart leads to what we call a heartbeat. On an average, in a healthy normal person, a heart beats around 72 beats in a minute. This means that heart muscles contracts and relaxes 72 times every minute. To do such an extensive work non-stop without any interruption, it requires continuous supply of oxygen. For this, heart has a network of its own blood vessels around which continuously supplies the oxygen to the various heart muscles. Any interruption of blood or oxygen supply to the heart for even a few seconds can impair its function and lead to heart failure and heart attack. Basically, a heart attack occurs when blood vessels supplying the blood to the heart are blocked. Now let's understand why there will be blockage of blood vessels. The main reason behind such an incidence is increase in blood pressure and excess of cholesterol and fat deposition in the blood vessels. Persistent high blood pressure damages the blood vessels by making them more rigid and by damaging the inner walls. This increases the risk of cholesterol deposition or fat deposition in the blood vessels. When there are excessive fat, it gets deposited in the inner walls of the blood vessels. It blocks the blood flow. Due to these blockade, heart of a person with a high blood pressure has to work harder to pump the same amount of blood throughout the body. This increases the workload and oxygen demand of the heart. The increased demand and lower supply of oxygen due to the blockade ultimately leads to the abnormal functions of the heart leading to heart attack. A heart attack may cause multiple symptoms. Chest pain is the most common symptom of a heart attack. This can feel uncomfortable pressure like aching, numbness, squeezing and fullness or pain in the chest. The discomfort can be spread to arms, jaws and back. It can last for several minutes and come and go. However, it's not only the symptom. Possible symptoms of an heart attack are dizziness, fainting and lightheadedness, nausea, indigestion and vomiting, and shortness of breath. These heart attack symptoms can be different for each person. No two heart attacks are the same, even for the same person. Person may have just one or a combination of symptoms. Sometimes the symptoms of the heart attack are not classic crushing chest pain that one thinks of. One may feel less obvious symptoms such as burning, feeling in the chest and shortness of breath. Sometimes one may have no symptoms at all. This is known as silent heart attack. A heart attack is a medical emergency. A heart attack can be diagnosed by medical tests. The only way to know that you are experiencing a heart attack is to seek urgent help. Medical tests include echocardiography, ECG, coronary angiogram and blood tests. So let's discuss one by one. Electrocardiogram or ECG. This can provide information about the extent and location of the heart muscle damage. It also detects the heart rate and the rhythm and whether or not one is having a heart attack. Echocardiography. It's an ultrasound of the heart and is used to learn how the heart is pumping overall and what areas may not be pumping well. Coronary angiography. It's an invasive test performed to directly visualize the size and the extent of the blockade of the heart vessels. It is frequently recommended in the first hours of a heart attack if medicines are not relieving the symptoms. Blood tests. Overall, these tests will measure the amount of damage caused to your heart and the best treatment that the course has to take. The heart attack most often requires emergency treatment to restore the blood flow to the heart. The faster it happens, the lesser the heart muscle gets damaged. Heart attack treatments may involve medications or surgery. Medications can be: number 1, drug therapy aims to break up, prevent of blood clots and stop platelets from collecting on sticking to each other and to the plaque, stabilizing the plaque and prevent more ischemia. Take these medications as soon as possible, preferably within 1 or 2 hours of the heart attack. This is to prevent the damage to the heart. Drugs used during heart attack include aspirin, clopidogrel, and other antiplatelet drugs like prasugrel. Thrombolytic therapy, which are known as clot busters. These are used to dissolve the blood clots in your heart arteries, and the combination of any of these drugs are used. Other drugs given during the heart attack which help your heart to work better and widen your blood vessels, lower your pain and help you in avoiding life-threatening heart rhythms. Drug therapy aims to break up or prevent blood clots and stop platelets from collecting and sticking to the plaque and stabilizing the plaque and preventing more ischemia. Take these medications as soon as possible within 1 or 2 hours from the start of your heart attack if possible to limit the damage to the heart vessels. One can reduce the risk of heart attack by making lifestyle changes. These are known as lifestyle modifications. The lifestyle modifications include treatment of blood cholesterol, exercise, cessation of smoking and limiting of the alcohol. Let's take one by one. Treating the blood cholesterol. Foods higher in saturated fats can contribute to high cholesterol and reduce the blood flow to the heart. It's also important to start healthy diet to reduce the risk. We should limit the foods that are rich in saturated fats which come from animal products such as cheese, fatty meats and dairy. Choose unsaturated fats which don't raise the cholesterol levels. One can find unsaturated fats in foods like nut, fish, vegetable oil, olive oil, etc. The diet emphasizes increase in the amount of vegetables, fruits, whole grains, poultry, fish and nuts, while curbing sugary foods and beverages. Eating and drinking too much sugar raises the triglyceride level. A healthy eating pattern also helps to manage the blood cholesterol level. Second important thing is to control the blood pressure. Also, drinking too much alcohol can raise the blood pressure. It also adds extra calories which may cause weight gain. Cigarette smoking and raising blood pressure puts you at a higher risk for heart attack. Excess salt intake is also known to raise the blood pressure. Reducing these factors can help reduce the further complication of it. Physical exercise and maintaining an ideal weight. So regular physical exercises makes the heart stronger. If one have a strong and healthy heart, it can pump more blood with less effort and reducing the risk of hypertension and valvular heart failure. Exercise cuts the cholesterol level and raises the good cholesterol in your body, which is the HDL. One can aim to get 2 hours and 30 minutes of moderate aerobic exercise per week, or 1 hour and 15 minutes of high intensity exercise such as jogging per week. Monitoring stress levels and getting adequate sleep are also possibly the best ways to prevent heart problems. It's important to remember that we can afford everything, but nothing is as precious as health. It's possible to make heart healthy and prevent heart failure or heart attack through lifestyle interventions and dietary modifications and exercise. By taking action to blood pressure, one can also prevent them against getting heart attack. Thank you so much.